Bismillahirrahmanirrahim. Welcome to the IMI Health Hour. This is my second talk on the subject of research ethics, which I started last week. And because it was rather exhaustive, so I stopped around the end of various protocols and various studies, and then talked about various parameters. But one particular subject that I deliberately left out was the subject of informed consent. Autonomy, informed consent, and consent in general. So I'll link up and patch up my discussion of last week, which was on research ethics, and pick up the thread from there. So we're going to talk about autonomy, which is the fundamental principle, one of the four pillars of medical ethics. Autonomy, beneficence, non-maleficence, and justice. These are the four fundamental pillars of Western ethics. Of course, in Islamic ethics, we have slightly variations in terms of the order, but basically the whole concept is that we're trying to cover up, link up these different parameters, the Western ethics with Islamic bioethics, and use universal ethics as a bridge, linking bridge between the different aspects. So when it comes to Islamic ethics, I will duly highlight the different, if there is any difference, but I'll carry on currently with the subject of autonomy, which is the important part of research, as well as any kind of clinical trials, studies, even medical treatment, therapies. And I did discuss it in my previous discussion in physician-patient relation, talking about consent. So I'll try to cover those. I will not be able to cover everything in detail, but I'll give you the outline. And literature is inundated, of course, nowadays, that we have various search engines which are available all the time. One has to type these root words or the keywords, and you get all the information that you need. So let me start with the fundamental thing, that consent is the very spine of autonomy, and autonomy is one of the four pillars of Western ethics. Like I mentioned, beneficent, non-maleficence, and justice being the other three. Different kinds of consent have been documented. Informed consent is the most fundamental. Then you have express consent, you have implied consent, you have general consent. You have specific consent, you have emergency consent, deferred consent, and surrogate consent. Now, each one has its own deliberation and discussion. And in my book on ethics, I have written extensively on these subjects. And my dear friend, late Dr. Maqbool Jafri, he was the guiding force for me. He, in fact, wrote massively on this subject in the book that we published many years ago. I'm hoping that with the new book that we are working on, the Encyclopedia of Islamic Medical Ethics, we'll try and cover each one of them separately, because at the moment, I will just give you an outline. So what is an informed consent? It is an autonomous action by a patient authorizing a physician to initiate a medical plan. Now, that medical plan could be in the form of medical care, or it could be in the form of research. And I did discuss in the research ethics that informed consent is a fundamental principle of research ethics. Same applies to medical care. Whether you're a physician or a surgeon, informed consent is a fundamental. Its validity, and the two words that come regularly in discussion, validity and credibility. Validity depends upon clear and substantial understanding of the disease or the underlying pathology and the nature of intervention, including the benefits as well as the potential risks. So if you mention only the benefits and not the risks, that is incorrect. You have to measure both things. The balance must be struck between the benefits and the risks involved in medical therapy, intervention, research, insertion of a gadget or surgery, what have you. Number two, the ability or the capacity and the competence to provide authorization to the physician to proceed. So if a patient is mentally competent, is able, is grown up, etc., all those factors that we have discussed in the previous debates also have to be kept in mind. People who are incapable or minors, or who are mentally retarded or mentally diseased or unwell, etc., they have special parameters for consent. But I'm talking about people who are grown up adults who come as patients, who come as volunteers, subjects of research. So that has to be kept in mind, that they are capable enough, they are competent enough they understand the full benefits of research or the application of research tools that you're carrying out. Then substantial freedom to make independent decision to continue or withdraw from treatment or therapy. So if you're conducting a research, the subject has a right, like I discussed previously in the previous discussion, that a subject has a right to withdraw without any misunderstanding or creation of any agony on part of the research scholar or the subject. There should be no misunderstanding. It's a very clear concept that if there is any harmful effect that patient doesn't want to continue, or the subject does not want to continue, then he has full right. Likewise in medical treatment also, if the patient decides not to continue the treatment, he has full right to withdraw. I should also mention that the physician also has a right to withdraw from a certain trust. If a physician is unhappy with carrying out treatment or research on a particular subject or volunteer or a patient, then he also has a right, but he should be clear to express and explain everything why is it happening, why is he withdrawing from carrying out this. Now, express and implied consent are very commonly used. Express consent is given either orally or in writing. It implies that the patient is fully cognizant of the proposed care and agrees to such a plan of treatment or research, and overtly demonstrates in some manner, form or gesture the willingness to proceed. Now this is very common. It happens if, for example, if there is somebody who comes in like for a routine blood pressure checkup or checking the thermometer or looking at various parts. So that is implied. If for example, if you say that, look, I want to take your temperature, the volunteers, if you want to check the blood pressure, volunteers arm. So that is implied consent or express consent, that he expresses the consent without writing it down. It's verbal, not documented. Implied consent is given like, for example, offering arm for an injection or for measurement of blood pressure, or you say that, look, could I take your measurements of height and weight? So volunteers goes to the scale. That is kind of implied consent. In other words, it doesn't have to be documented. The words, the actions will indicate a consent. If a patient submits to a procedure with actual apparent knowledge of an impending action, the consent will be called an implied consent, even though the verbal or written consent may not be existing. Like, it's taken as a verbal consent, not written consent as such, because it's expected that if you're carrying out a medical examination, it's very basic, then you don't need to document, but it's best to tell the patient what you want. Everything must be very clearly carried. In research also, you tell the subject, this is what I want to do, and you should give in the form of indication and carry on procedure. In an emergency, the situation is totally different, because sometimes the patients come in a state of acute cardiac condition or head injury or whatever. There is no time to document. So that is an emergency consent, which is like general consent, specific consent, deferred consent. They are acceptable as the patient provide consent by presenting in an emergency room for medical care and attention. It usually involves signing an emergency record and agreeing to evaluation and intervention. This is something that we are all familiar in clinical practice. It is not really an informed consent, because it's an emergency. You have to carry out that particular procedure, maybe insertion of a nasogastric tube or an IV line, or carrying out a tracheostomy in an acute emergency, or using a laryngeal intubation, etc., etc. So you can't really, you have no time to carry on this, but you express it to the patient or patient relative, next of kin, that this is the intention, and the intention is to relieve the patient of acute emergency. Okay, specific consent most likely if you approach the patient with the concept of informed consent in an emergency situation. So a consent for a specific procedure or intervention, for example, like I mentioned, you want to insert a tube, a nasogastric tube or a laryngeal tube, or you carry out a tracheostomy, which may have risks, of course, they can have complications, and which are known to physicians who are carrying. Likewise in research, if you want to carry out any procedure which may have certain risks, so specific consent has to be obtained. Emergency consent is applied in true emergencies such as cardiac arrest, or an elderly patient falling acutely ill, say due to pneumonia or a fall, head injury or broken hip, or critically ill patient requiring a life-saving procedure like cardiac paracentesis and a cardiac tamponade, or things like this. Now, these are emergency consents where a fully informed consent may be deferred and can be carried out laterally. Deferred consent is applied in research protocols involving a critically ill patient in an emergent situation, unable to give a formal, fully informed consent, allowing a procedure to commence. Retrospective consent is usually obtained following formal from a family member or next of kin at a later date. So because you have no time, so you carry out the procedure, you defer the consent after explaining whatever you can to the relative or the next of kin, but a proper consent should be carried out at a later stage when the matters are resolved. What are the basic elements of an informed consent? Number one, clear and precise explanation of the proposed plan of treatment or research, if you're doing research, a procedure and what may follow, including identification of an experimental procedure, a model or a module. Everything has to be very clear. If you're carrying out surgical intervention, everything has to be documented. Potential benefits as well as risks, possible complications, anything that you may not see but you might feel that that procedure might ensue following the basic procedure that you're carrying out. For example, if you're carrying out laparotomy and something happens, something goes wrong, the gut ruptures and you have to repair it, you have to mention all those things. Everything's documented. Like I said in one of my discussions, anything which is not documented and said verbally in informed consent does not hold good. You have to document it. So also mentioning discomfort, risks and benefit and possible harms that might arise. Clear and precise description of the expected benefits. A clear disclosure appropriate an alternative procedure or therapy that might benefit the patient. I discussed that previously in the research ethics also, that before you start research, it's a new subject, new topic, new drug, new gadget, discuss with the subject that these are the things that we want to do because we feel benefits will be more, but the alternate therapies, treatments or gadgets are available. So the patient or volunteer has full right to access to the already established norms, or volunteer and go for research trials, in this case in clinical application. If something you want to try out new, you have to clearly express that the alternatives are available. Best possible efforts to answer any queries concerning the procedure. That is important because you have to be very clear, you should monitor and be careful in giving your answer. Be precise, be as brief as possible, but be very clear. Deliberate, discuss, deliberate. A clear understanding that the patient may withdraw from the treatment anytime. You have to say that in therapy and research, any procedure that's carried out may have side effects or any complications. You should discuss. The patient or subject has the right to withdraw from it without any prejudice, without any ill feeling, without any bad blood. The validity of informed consent becomes questionable if the patient fails to fully comprehend or the physician fails to fully explain the procedure. It is called informed but uneducated consent. This can happen to all of us. This can happen. Therefore, be very careful in research as well as practical application, because if you do not carry out those procedures giving full informed consent, then the procedure becomes a nuisance. Now here I would like to introduce the Islamic concepts of moral acts, because I'd like to talk briefly about the fundamental role of justice in medical ethics and medical research. So Islam categorizes 5 categories of moral acts: obligatory acts, acts recommended by law, acts which are permitted by law, acts which are forbidden by law, acts forbidden totally by haram, halal, all that concept that all of us are clear. That has to be very clear. So moral acts are clear. Now I'd like to briefly talk about justice, because that is the pillar of ethics. Informed consent, autonomy, beneficence, non-maleficence, justice. Justice is the pillar of ethics. It is one of the 5 pillars of Islamic ethics. In Fiqh Jafariya, it is one of the pillars of ethics. Tawheed, Adl. Adl is important. Adl is one of the attributes of Adl, is the attribute of God. Justice, comes into play in every action in medical profession, whether doing research ethics or treating the patients. Justice is a moral act. Justice means giving everyone that is due on the basis of equity, and it's either distributive or retributive in nature. And pursuit of justice could be individualistic, it can be confined only to a person, or it could be collective to a society or community or humanity at large. There are 4 types of justice which come into play. Commutative, based on the principle of equality. Distributive, guarantees the common welfare by sharing what is good and what good has been created by that particular action. Legal, the obligations of the government to its citizens and society, hence opposite of distributive justice. Social, everyone has a right to fair say in a society. Then there are 2 dimensions of individualistic justice, and these dimensions are justice to oneself, that's personal or self, justice to other individuals. And there are 2 further aspects of justice. Each form of justice may have positive or negative effects. To say that justice will always be, justice is a very difficult subject. That is why we say that Allah is Adil. We worship Allah, we request, we pray for, not for adl. We cannot withstand adl ilahi. We ask for forgiveness, for rahim, for karam, for fazl, not for adl, because we cannot withstand it. At the individualistic level, Quran has mandated these principles to establish positive devotion for the harmonious development of personality, and that is the fundamental rule of Islamic ethical principles. Remain on guard against negative factors in respect of personality. Give one what is due without restraints. Refrain from defrauding others in matters of their rights and obligations. Rights and obligations go together, and one of the discussions about patients' rights and obligations, I did mention that it's like seesaw. You have to balance them out. Rights cannot be without obligations. You cannot have first without the benefit of having the compensation. So if you carry out a certain activity, a duty, you must be compensated. That compensation should be based upon the principle of justice. In collective justice, Quran instructs that communities emerge out of collection of individuals. Community is a collection of people, society. So justice in social relationship is important. Justice in respect to the process and enforcement of law is important. There is economic justice, is a subject in its own right. Then there is political justice, of course, important. The metaphysical aspect of justice, because justice is not only physical but also metaphysical. To combine justice with goodness may be a primitive concept. Equated with righteousness combined with faithfulness, loyalty, loftiness of character and personal devotion and sincerity may not necessarily become an integral part of medical ethics. Fundamentals of distributive justice are to each person an equal share, to each person according to the need, to each person according to the efforts. So you cannot do that, look, he's my relative, I should give him, no, that's not possible. To each person according to the contribution made in that particular effort, to each person according to the merit, to each person according to free market, to each person according to exchanges. There are different theories of justice, and I'll go through it quickly because I have to cover in the next 10-15 minutes. There is utilitarian theory, which emphasizes upon a mixture of criteria for the purpose of maximizing public utility. Then there is libertarian theory. It emphasizes upon the rights to social and economic liberty, invoking fair procedure rather than substantive outcomes. Communitarian theory, it stresses upon the principles and practice of justice that evolve through traditions in a community or society. Egalitarian theory, which emphasizes upon equal access to the goods in life that every rational person values, often invoking material criteria of need and quality. And this is a reference of Beecham and Childress' famous book on medical ethics, and that I've used as a source of information. The most famous of all theories at the moment is John Rawls' theory. He was a famous philosopher of modern times. His theory is called social contract theory, justice as fairness. It is based upon the greatest equal liberty principle, the greatest equal opportunity principle. And when I talk about justice, invariably virtue ethics comes to my mind because that's my favorite subject. Justice is the fundamental pillar of virtue ethics. It is an integral part of the cardinal rules rather, which are courage, prudence, compassion, and practical wisdom. If you combine these things right from the times of Plato to modern philosophy like Alexander McIntyre, it leads to happiness. Plato called it eudaimonia, that means happiness, which is not really the right explanation or translation of the word. Eudaimonia is more like itminan al-qalb, that if you have courage, prudence, compassion, practical wisdom, and justice, you base your life on these principles, you will end up with happiness in life, with itminan al-qalb. Now, I would like to conclude here that I've touched upon basically on the concept of autonomy, informed consent, and various forms of consent in brief, and I have related it to justice because autonomy, if you cannot give rights to an individual based upon the principles of justice, and justice is equal distribution of resources, different factors that I mentioned here, then autonomy will not be applicable. It is of invaluable importance that justice should form the pillar of medical ethics, whether you're carrying out research or treating your patients as subjects. Likewise, it's important that you should know that research ethics, the fundamental role of research ethics or medical treatment is to benefit the mankind. If you keep justice as a founding brick in the application of research ethics or in application of formulae for research ethics or in carrying out medical care, if you have justice guiding your principle, it is in your conscience. And I've always said in my debates and discussions and my lectures that justice is the tangible form of your conscience, whereas knowledge and skills give you power and authority to execute the power and authority to the benefit of mankind. Also, you can use the same for evil purposes, like the famous example of radiation for cancer treatment or atomic bomb, and many things out of that. You can use a knife for cutting an apple or somebody's throat. It is the most fundamental, the third element of ethics, the justice, which forms the triangle of ethics. So knowledge and skills combined with justice, and justice should be visible, palpable, it should be clearly mandated, it should be clear, it should be observable, it should be applied in practical, and not only to yourself but also to society, at the individual level, at the communal level, at the societal, at the humanitarian level, at all levels. Justice should form the fundamental rule of research ethics as well as medical practice. My favorite subject at the moment, or principle that I use in my reading and writing and research, is John Rawls' theory of social contract. Now, that is the formula which is being used, and a lot of people say that it was applied in the social contract that we see in the NHS. Many lateral developments have taken place since, but the fundamental thing is that in social contract there should be equal or level playing field. So if an able person has to compete with an able-bodied person and disabled with a disabled person, and that, if applied into research ethics, applies also to people who engage in research in the developing countries. So if you go from the Western countries to carry out research in the developing countries where people may not be fully aware of the risks and the benefits, that's mandatory that you observe the principle of justice. If your conscience allows that particular research, that particular treatment, that particular therapy, that particular surgical appliance or intervention, if your conscience permits, then it's ethical. If the conscience does not allow it, and your conscience says that you're doing it for your personal glory or benefit or financial reward or to show off or whatever, or magnify your image, so forth, then that is unethical. That must be stopped. So remember that the fundamental rule of ethics, whether it's research ethics or applied ethics in practical forms in medical care, interventions, medicine, surgery, what have you, justice should be the fundamental pillar of ethics. Any intervention, any new gadget, any treatment, any therapy which has not been fully tested, and you want to treat it, you want to apply it to a volunteer or a subject or a patient, fundamental rules that I've discussed in the previous debates have to be guided. Helsinki Declaration has to be observed. Belmont's principle has to be observed. There might be certain guidelines applicable according to the national and international needs, but national guidelines are available to the countries, in the countries where one goes for research. Follow those guidelines. Remember, ethics should be culture sensitive. If you do not observe the local adab, akhlaq, tehzeeb, etc., in a particular country where you're going to carry out research from the developed to the developing countries, then that becomes unethical. Any kind of authoritative approach in research ethics always, almost always raises question. And authority with dignity. If you honor, if you give due respect and tell the truth, be very clear and precise and explain everything that you want to carry out, then it's ethical. Anything which you want to withhold for the benefit of mankind, for the benefit of patient, making it very clear that these certain things are best that if you do not deliberate at this stage. We'll discuss when the time comes, because many times, like I said in the previous discussion, too much of knowledge can also create problems. We see these patients all the time with a whole list of information available, talking about I can give an example in my own field in tinnitus. Tinnitus is a very vague condition where you have noises in the ear. We don't know what causes it. People come to us with a whole lot of information, think of the worst possible things, for like a tumor in the brain or developing disseminated sclerosis or neurological disorder. The job of a physician is to clearly discuss, explain, justify your observations, your knowledge, and explain to them that what is here and what you read is not always applicable to you. So you have to be clear, allay the fears, the anxiety, the stress, make them more comfortable. The same formula that applies to research ethics in application of ethical principles in human subjects applies to medical treatment when it comes to applying practical therapies like drug therapies. And I've discussed in the previous discussion the role of placebo, how they have to be applied. One has to be very careful. Placebos are controversial. Justice should be the fundamental, the guiding principle in any kind of research ethics and any kind of medical care. And I will discuss at some stage on distribution of resources based upon the principles of justice, because as the services are expanding and resources are falling, limited resources with allocation, rationing, gatekeepers, all these parameters have to be kept in mind. So what are the parameters which determine and make you comfortable, your conscience comfortable in distributing the services to the persons who actually need it, and what should be the criteria? That may be the subject of a future discussion. But right now I'd like to say thank you for listening to me, and do forgive me for any mistakes and typos. My objective is to disseminate knowledge as best I can. I am only a humble student of medical ethics. What I learn, I want to assimilate, digest, and then translate to make it simple for my colleagues, doctors, research scientists, and obviously, first of all, for the general public to benefit through this TV channel, the Ahlebait TV channel, which has given a source for dissemination of knowledge across the borders. So I'd say Khuda Hafiz and goodbye until we meet again.